Okay, imagine your dog or cat has a cough. Or maybe they're sneezing a bit more than usual.
Right.
Most of the time, you probably don't think much of it, right?
Yeah.
Maybe just a little bug, some dust.
Sure, common stuff.
But what if that simple symptom was actually a sign of something far more complex, something, living deep inside them that you can't even see?
It's a world few pet owners really consider, but yeah, beneath the surface, the respiratory systems of our pets can sometimes harbor some pretty surprising inhabitants.
Parasites.
Exactly. These aren't just simple colds, they're often hidden parasites.
And that hidden world is exactly where we're diving today.
Ah.
We've been digging into some incredibly detailed sources. Think of them as like deep wells of veterinary knowledge,
Very comprehensive.
giving us a really full picture of the parasites that specifically target the lungs, airways, and even the blood vessels tied to them in dogs and cats.
And our mission really is to pull back the curtain on this pretty complex topic and make it clear and relevant for you. We want to understand what these parasites are, the often surprising ways pets pick them up, the tricky signs they cause,
Definitely tricky.
how veterinarians unravel the mystery, and crucially, why knowing this stuff is, well, it's a real shortcut to being a more informed pet owner.
Okay, so let's start at the beginning.
Yeah.
When we talk about respiratory parasites, what exactly are we dealing with? Is it just like worms?
That's a great place to start because the sources make it really clear it's much more diverse than just one kind of worm.
Okay.
We're talking about helminths, yes, those are the worms, but also arthropods like mites and even protozoa, tiny single-celled things.
Wow.
It's a whole menagerie of organisms that have, found ways to make the respiratory tract their home.
Well, they don't all live in the same spot, do they? The sources highlighted that their address within the respiratory system really matters.
Exactly. They can live right up high in the nasal cavity and sinuses, or down in the trachea and the larger bronchi, the main airways,
Right.
or deep within the lung tissue itself, what vets call the pulmonary parenchyma,
Parenchyma, okay.
or even inside the pulmonary blood vessels connected to the lungs.
Okay, so depending on where they set up shop, the problems they cause are different. Like if they're in the nose, it's a nose problem. Lungs, a lung problem, sort of.
You've got the basic idea, yeah. If they're in the nose or sinuses, they cause inflammation we call rhinitis.
Rhinitis.
In the main airways, it's bronchitis.
Oh.
In the lung tissue, pneumonitis. And if they get into those blood vessels near the lungs, they can cause arteritis, that's inflammation of the arteries.
Ah.
And what's a key insight from the sources is that many of these parasitic invasions trigger a specific type of inflammatory response called eosinophilic inflammation.
Eosinophilic inflammation. Okay, what does that mean for the pet? Is it bad?
Well, think of eosinophils as a type of white blood cell. The body often sends them out specifically when it detects parasites or maybe has an allergic reaction. So finding a lot of these cells can be a clue, that a parasite might be involved, even if you can't see it directly.
It's the body fighting back.
It's the body's way of trying to fight off these particular invaders, absolutely.
Yeah.
But that fight itself can cause a lot of the symptoms the pet experiences.
It was surprising to me reading this that it's not just about the lungs. Some of these can mess with other parts of the body too.
Oh, absolutely. While their main hangout is the respiratory system during different stages of their life cycle, or if they sort of wander off.
Migrate.
Migrate, exactly.
Yeah.
They can impact other systems. The cardiovascular system, obviously, if they're in those pulmonary vessels.
Right.
Makes sense.
But also the liver, for instance, during larval migration for certain worms like Toxocara, or even the nervous system.
The nervous system. Like the brain. Seriously.
Yes, seriously. For example, Cuterebra larvae, those are botfly larvae, can sometimes migrate aberrantly, abnormally, right into the brain, and that causes severe neurologic signs. And another one, Aelurostrongylus, can cause bleeding issues, which could include bleeding in the nervous system. It just highlights how complex and far-reaching these infections can be.
Okay, that's the what and the where. Now for the how. How on earth do our pets actually get these things? It can't be as simple as just breathing them in for most of them. Right?
You're right. And this is where it gets really fascinating, actually, because the life cycles are often quite intricate, and they vary hugely depending on the specific parasite.
Uh-huh.
This is where those surprising exposure risks come into play, things you might not expect.
I remember the sources emphasizing this idea of needing help. meeting other animals to complete their life cycle.
Yes, exactly. Many respiratory parasites require what's called an intermediate host.
Intermediate host.
These are other animals, often things like snails, slugs, or even certain crustaceans, where the parasite larvae develop into an infective stage, ready to infect the final host.
Which is the dog or cat.
Which is the dog or cat, the definitive host. So the pet gets infected by eating that intermediate host.
So a dog eats a slug and boom, potentially.
Potentially, yes. For some lungworms like Crenosoma vulpis or Aelurostrongylus abstrusus.
Okay.
But wait, it gets even more complicated. Sometimes the pet doesn't eat the intermediate host directly. Instead, they eat a paratenic host.
A paratenic host, what on earth is that?
Think of it as a transport host, like a carrier.
Okay.
Animals like rodents, frogs, lizards, or birds might eat the infected intermediate host, say, the snail with the larvae.
Right.
And the parasite larvae survive inside them without developing further. They just hang out.
Waiting.
So when the pet then hunts and eats that paratenic host, the mouse or the bird they get infected, the paratenic host just gives the parasite a ride, essentially.
Wow, that's like a whole chain reaction. So what are some of the most sort of unexpected ways the sources say pets can pick these up via these hosts? Any weird ones?
Well, beyond snails and slugs, which are common for many lungworms, the sources mention the lung fluke, Paragonomus calicoti. That one needs snails first, and then crabs or other shellfish. Crabs. And ingesting sheep offal like internal organs was listed as a way to get linguatula lacerata. Definitely not something you'd normally think about.
No.
And another one, Angiostrongylus visorum, involves gastropods like slugs and snails as intermediates, but then frogs can act as paratenic hosts.
Crabs. Sheep parts. Frogs.
Okay, that really opens your eyes to what a scavenging dog or an outdoor hunting cat might encounter, doesn't it?
It absolutely does.
Yeah.
And remember, not all are indirect like that. Some parasites have more direct life cycles.
Oh, yeah.
Oslerus, osleri, and Philoroids hirthi, for example. They can be transmitted when dogs ingest larvae found in the feces or even respiratory secretions like saliva or mucus of an infected dog.
Ugh.
So this is a particular risk in places where dogs are housed closely together, like kennels or multi-animal shelters or just in environments with poor sanitation. And we can't forget the big one with an intermediate host everyone knows, right? The mosquito for heartworm.
Exactly. Dirofilaria immitis. The mosquito bite is the key transmission step there.
So linking all these ways they get them, the transmission methods to the risk factors seems crucial.
It is. Animals that hunt or scavenge those outdoor adventurers, your cat that brings you presents.
Yep.
They're naturally at much higher risk for picking up intermediate or paratenic hosts. And as you mentioned, places with multiple animals and maybe less than perfect hygiene, well, that increases the risk for those directly transmitted parasites.
Okay, so a pet has managed to pick up one of these sneaky passengers. What does that actually look like? What signs might you see or not see?
Well, this is where the real challenge often lies, both for owners and vets. Because, as the sources really highlight, these infections can be insidious, meaning they develop slowly, sneakily, and chronic, lasting a long time. Often, there are few clinical signs, maybe none, and the respiratory impact, the breathing problems are frequently not severe.
So they could have it and seem totally fine.
Exactly. A surprising number of infections are subclinical, meaning the pet shows no visible symptoms at all.
Invisible parasites causing invisible problems. How are you supposed to spot that?
It really requires that high index of suspicion we talked about. Vets have to think about it, especially if the pet has a risky lifestyle or lives in a certain area.
Okay. But when signs do show up, what are they?
Well, they really depend on where the parasite is living. Location, location, location.
Like up in the nose.
Right. If they're in the upper airway of the nose or sinuses, you might see sneezing, maybe some nasal discharge that can sometimes even be bloody.
Bloody nose?
We call that sanguineous discharge. Or even reverse sneezing, that weird snorting inhale they do.
Oh, I know that sound.
Yeah. They might also rub at their nose a lot. And the sources specifically mention that neurologic signs can sometimes occur with Cutirabra, that fly larva, if it migrates abnormally up there.
Okay. What about lower down in the lungs or the main airways?
Lower airway or lung tissue parasites. Well, they can cause coughing, but even that is variable. Sometimes there's no cough at all.
Really? No cough with a lung parasite?
It happens. You might see an increased breathing rate, what vets call tachypnea, or maybe just an altered breathing pattern. Vets will often check for a cough by gently pressing on the trachea, the windpipe in the neck. If that makes them cough, it can be a sign. And listening to the lungs, you might hear harsh sounds, maybe crackles or wheezes.
And the ones in the blood vessels,
Yeah.
like heartworm. That's different again.
Yes, vascular parasites like heartworm tend to cause more systemic signs. Things affecting the whole body, like weight loss, maybe being really tired or lethargic, that persistent cough again, and getting tired easily with exercise intolerance.
Okay.
If the infection is severe or if complications like blood clots or bleeding happen, you can see really sudden acute respiratory distress, big trouble breathing.
Carrie.
And advanced heartworm, well, that can lead to clear signs of pulmonary disease, right-sided heart failure, anemia, blood clotting problems, coagulopathy, and yes, even neurologic signs if clots travel to the brain.
Wow. The second source you mentioned had some really specific descriptions of symptoms too, didn't it?
It did, yeah. It listed cough as the single most common sign and described it in detail. Dry, moist, harsh, persistent. Sometimes followed by gagging or retching, like they're trying to cough something up. Difficulty breathing or rapid breathing dyspnea or tachypnea is mentioned. And it specifically notes that open mouth breathing in a cat is always a major concern.
Right. Cats shouldn't pant like dogs.
Exactly. You might hear wheezing or crackles when listening to the lungs. Epistaxis, that's nosebleeds, can happen with nasal parasites like Eucoleus or even with lung flukes like Paragonymous.
Nosebleeds from a lung fluke. How?
Sometimes the inflammation or the parasite itself can cause bleeding that finds its way out the nose. Vomiting can happen too. Sometimes it's just from severe coughing fits, or it's listed as a potential sign of feline heartworm specifically.
And the really bad outcomes.
Tragically, sudden death is possible, especially in cats with heartworm, often due to complications when the worms die off suddenly and cause blockages, or just with overwhelming numbers of parasites.
Oh, man.
Advanced heartworm can also cause fluid buildup in the abdomen that's ascites or fainting spells called syncope.
So the bottom line is symptoms are subtle, they're varied, often they're absent entirely, and they can look just like everyday things. This sounds incredibly difficult to diagnose.
You've absolutely hit the nail on the head. Diagnosis is challenging, precisely because the signs are so nonspecific, and the parasites or their eggs or larvae might not be shed consistently in samples like poop.
Intermittent shedding.
Intermittent shedding, exactly. This is why vets need that really high index of suspicion, especially if they know the pet's lifestyle involves those risk factors we discussed.
So it's definitely not just a simple physical exam and you're done.
Oh, far from it. It usually requires a multimodal investigation, a whole detective process.
Yeah.
A thorough history and physical exam are the starting point, of course. Learning about the pet's environment, travel history, hunting habits, mosquito exposure, all vital clues.
And lab tests. Blood work.
Routine lab tests like a blood count, a CBC, might show that eosinophilia we talked about.
The parasite fighters.
Right, indicating a parasitic or maybe an allergic process.
Yeah.
But it's not always there, so you can't rule parasites out just because the eosinophils are normal. Anemia, low red blood cells, can be a clue with Aelurostrongylus or severe heartworm. And sometimes blood clotting tests are needed for certain parasites.
Okay, but how do they actually find the parasite itself or its evidence? I heard you mention special fecal tests before.
Yes, this is a critical point the sources really emphasize. Because standard fecal flotation, the test most people think of for intestinal worms, often won't find these respiratory parasites. Because many of them shed tiny larvae, not eggs, in the feces. Or their eggs are too heavy to float properly in the standard solutions.
Ah, okay. So standard test misses them. What are the special tests then?
The Behrman technique. This is absolutely crucial for many lungworms. It's designed specifically to concentrate the tiny larvae, the L1 stage, that are shed in the feces.
How does it work?
It's clever. It uses the fact that these larvae are alive and motile. You suspend the fecal sample in water in a special funnel setup, and the larvae wiggle out of the feces and sink down into the bottom stem of the funnel.
Gotcha.
You then collect that sediment and examine it under a microscope. That's how you find things like Aelurostrongylus, Oslerus, Cranosoma, Phileroids, and Angiostrongylus.
You might need more than one test.
Yes, because shedding can be intermittent, remember. So the sources suggest testing multiple samples, maybe over a few days, to increase the chances of finding them if they're there.
Okay, so Behrman for the larvae. What about parasites that do shed eggs?
Standard fecal flotation is used for parasites that shed eggs like Eucoleus or Paragonymous, although using a specific solution like zinc sulfate can sometimes improve recovery. But for really heavy eggs, like those of Paragonomus, even flotation might not work well. So a sedimentation technique is needed, basically letting the heavy stuff settle out instead of trying to float it.
Sedimentation, okay.
And sometimes, just a simple direct smear of fresh feces under the microscope might reveal Angiostrongylus larvae.
What else can vets do to look for them? Can they actually see them inside the pet?
Yes, imaging is another key tool, although the findings can often be non-specific, just showing general inflammation.
X-rays.
X-rays, exactly. They might show general inflammatory patterns in the lungs, but sometimes they reveal more distinct signs, like little nodules or bumps in the lung tissue,
Nodules.
which could suggest Oslerus or Paragonomus, or you might see cystic lesions, fluid-filled pockets with Paragonomus. And the sources warn that these cysts can actually rupture, which is a serious complication.
Yikes.
X-rays can also show changes in the heart size or shape, or prominent pulmonary arteries, which are often associated with heartworm disease. And CT scans, well, they offer much more detailed images than standard X-rays.
And can they physically look inside the airways?
Yeah.
With a camera?
Precisely. Endoscopy. Using a tiny camera on a flexible tube allows vets to directly visualize parts of the respiratory tract.
Cool.
Rhinoscopy looks inside the nasal passages where they might actually see nasal mites. Bronchoscopy goes down the trachea and bronchi, the larger airways. There they might see the nodules caused by Oslerus or even spot adult worms sometimes.
Wow, actually see the worms.
Yes. And endoscopy also allows them to collect samples directly from the site. Things like a tracheal wash or a bronchoalveolar lavage, often just called a TW or BAL.
What's that involve?
It involves instilling a small amount of sterile fluid into the airway and then suctioning it back out immediately.
Okay.
This collects cells, mucus, and hopefully parasite larvae, eggs, or even the organisms themselves, like toxoplasma stages, if that's involved. And in some cases, like with Linguatula, the tongue worm, parasites can sometimes even be physically removed during the endoscopy procedure.
Okay. And blood tests.
Yeah.
They're mainly for heartworm, right?
Exactly. Heartworm testing is primarily done via blood tests. The most common is an antigen test.
Antigen test.
It detects specific proteins produced by adult female heartworms. It's important to know, though, that these tests are generally more sensitive in dogs than in cats.
Why is that?
Partly because cats often have much lower worm burdens, maybe only 1 or 2 worms, or they might only have male worms, which the antigen test won't pick up.
Ah, okay. So what about cats then?
In cats, an antibody test is also really useful. It doesn't detect the worm itself, but it indicates exposure to the parasite. So a positive antibody test tells you the cat has been infected, even if adult worms aren't present or detectable by the antigen test.
Got it. Antigen for dogs mainly, antibody useful for cats.
That's a good summary.
Right.
And finally, sometimes the definitive diagnosis comes from pathology examining tissue samples collected surgically or, unfortunately, during a post-mortem examination that can reveal the actual mites, worms, nodules, or vascular changes, or even seeing something like cutirabra in the brain tissue.
Okay, so the vet has done all this detective work, maybe a Baraman, maybe endoscopy, maybe blood tests, and they've found the culprit. They've identified the parasite. How do you get rid of it? Is there just like a standard dewormer that works for all of them?
Oh, if only it were that simple. No, absolutely not. Treatment is highly specific to the identified parasite.
Right.
And it's important that the sources are careful to note this. For many of these less common respiratory parasites, the treatment protocols are often based more on empirical evidence, what seems to work in practice, or anecdotal success stories, rather than large-scale, controlled scientific studies.
Okay, so it's more like, this usually works for that one.
To some extent, yes, especially for the rarer ones. Vets rely on published case reports and expert experience.
So what kind of treatments are we talking about with drugs?
Primarily anthelmintics drugs that kill worms, basically. The sources list several types used.
Okay.
Macrocyclic lactones, that's a big class of drugs. It includes medications many pet owners might recognize, like ivermectin, milbemycin oxime, silamectin, and moxidectin.
Yeah, those are in heartworm preventatives.
Exactly. They're used for various lungworms and are the mainstay for heartworm prevention and also for killing the microfilaria, the baby heartworms circulating in the blood.
Okay, what else?
Fenbendazole is another commonly used drug. It has broad activity against many types of nematodes or roundworms, including some that affect the respiratory tract.
Fenbendazole.
Got it. Then for flukes, like Paragonomus, you need a different type of drug, typically praziquantel.
Praziquantel for flukes. Okay.
And for treating established adult heartworm infections in dogs, That's different again.
Right. That's the big one. What's used there?
For adult heartworms in dogs, the standard treatment is a drug called melarsamine. It's an injectable arsenic-based drug, quite powerful.
Arsenic. Wow.
Yes, but formulated safely for this use.
Yeah.
And importantly, the sources explicitly state it is contraindicated, meaning it absolutely should not be used in cats. It's too dangerous for them.
Okay, melarsamine for dogs only,
Yeah.
not cats.
Correct. And for canine heartworm treatment, vets often use doxycycline, an antibiotic, alongside the melarsamine.
An antibiotic for a parasite.
Yes, because it targets a type of symbiotic bacteria called Wolbachia that lives inside the heartworms. Killing these bacteria weakens the adult worms, makes the melarsamine treatment more effective, and seems to reduce the risk of complications after the worms die.
Fascinating. Bad bacteria inside the worms.
It is. And just one more example, for Aelurostrongylus, the cat lungworm, a drug called imodepside, often in a topical spot-on formulation, is mentioned as effective.
Okay, so lots of different drugs for different bugs. Beyond just killing the parasite, what else might a pet need during treatment?
Good question. Supportive care is often crucial, especially in sicker animals or those having reactions to treatment.
Like what?
Depending on the severity, this could involve supplemental oxygen if they're having trouble breathing, anti-inflammatory medications like steroids. Although the sources do mention there can be varying opinions or recommendations on using steroids depending on the specific parasite and situation. Bronchodilators to help open up the airways, and sometimes antibiotics if there's concern about a secondary bacterial infection developing in the damaged lungs.
Makes sense.
And strict rest is also really important, particularly during and after heartworm treatment in dogs, to minimize strain on the heart and lungs as the worms die off.
And I remember something about surgery being mentioned. Is that common?
Not common, but possible for specific situations. The sources mention surgical removal or excision of ruptured perigonous cysts if they're causing problems, or sometimes physical removal of linguatula if they're accessible during endoscopy, for instance.
Okay, so treatment starts. What's really important for a pet owner to know and understand during this process?
Client education is absolutely vital, as Source 1 emphasizes. You, the owner, need to understand that the duration of treatment can vary quite a bit, and the pet's response, how quickly they get better, really depends heavily on the specific parasite, how bad the infection was, and how long it was going on.
Okay, manage expectations.
Exactly. And crucially, the sources stress the importance of warning owners about the risk of recurrence.
Sending back.
Yes. Especially for pets with lifestyles that led to the initial infection in the first place. The hunters, the outdoor explorers, those living in multi-animal settings where exposure might continue, they are likely to be re-exposed.
So treatment might work, but they could just get it again.
They could. So ongoing prevention or management strategies become really key for those animals.
Prevention definitely sounds like a much better option than going through all that treatment.
Yeah.
How can someone try to avoid these problems in the first place?
Avoidance is absolutely the most powerful tool here. It's the best strategy.
So number one is probably heartworm prevention.
Non-negotiable. Consistent year-round prevention with appropriate veterinarian recommended medications is essential, especially if you live in or travel through areas where heartworm is endemic, which is most places these days.
Year-round, even in winter.
Yes, the recommendations generally support year-round prevention now because mosquito seasons can be unpredictable, and the preventatives often cover other parasites too.
Okay. And based on those crazy life cycles we talked about, keeping pets away from certain things seems pretty important too, right? Snails, slugs.
It really ties back directly to understanding those intermediate and paratenic hosts. Minimizing a pet's ability to hunt or eat things like snails, slugs, crabs, rodents, frogs, birds, whatever the specific parasite uses, that significantly reduces the risk for many lungworms and flukes.
Easier said than done for some cats.
Oh, absolutely. But doing what you can helps. Good hygiene practices also play a role. Cleaning up feces promptly in the yard or litter box helps prevent the spread of parasites with direct life cycles, like Oslerus or phylloids.
And stopping dogs from eating poop.
Yes, preventing coprophagia, or stool eating, is also important for those directly transmitted parasites.
Okay. And what about just regular deworming? Does that help with these respiratory ones?
Well, standard dewormers aren't usually a magic bullet for established respiratory parasites, as we discussed with treatment being specific. However, Regular deworming protocols, particularly for puppies and kittens, do help prevent issues caused by migrating intestinal worms.
Ah, like the Toxocaria you mentioned.
Exactly. Those worms pass through the lungs during part of their life cycle. So yes, routine deworming is definitely part of a general parasite control strategy and can prevent some respiratory signs indirectly.
Okay, so let's say a pet has gone through diagnosis and treatment. What's the overall outlook, the prognosis, and what are the potential really serious problems that could linger or happen down the line?
The prognosis, or the expected outcome, is quite variable. The sources say it can range from fair to excellent, often depending on how aggressively the infection is diagnosed and managed.
Depends on the situation.
It really does. Key factors are which parasite it was, how severe the infection was when it was caught, how long the pet was infected before treatment, their age and overall immune status, and importantly, if complications occur. And remember, as we said, there's always that potential for recurrence if exposure continues.
Right. What are some of those serious complications the sources warned about? The scary stuff.
They listed several potential serious issues, things like chronic lung damage, scarring, or fibrosis, or persistent inflammation called granulomas.
Long-term damage?
Yes, which can lead to an ongoing cough or persistent breathing difficulties even after the parasite is gone.
Okay.
Really serious long-term cardiovascular problems like pulmonary hypertension, high blood pressure in the lungs, and eventually right-sided heart failure are significant risks, especially with advanced or poorly managed heartworm disease.
Heart failure. Wow.
Pets can also develop secondary bacterial pneumonia because the damaged lungs are more vulnerable. Airway obstruction is possible if there are very heady worm burdens or large nodules blocking the passages. And hemorrhage or bleeding within the lungs, hemoptysis, can happen with some infections.
Bleeding in the lungs.
We also talked about sudden death as a severe, though thankfully less common, outcome. Particularly mentioned for cats with heartworm, often due to embolization when worms die, or just with overwhelming parasite loads of any type.
Right.
Migration of parasites outside the respiratory system is another potential complication we touched on, like cuterebra, causing neurologic issues if it gets into the brain, or paragonymous potentially migrating to other organs in the body.
And there was that note about some of these potentially affecting humans too, the zoonotic risk.
Yes, that's an important public health point to remember. Some respiratory parasites, the sources specifically mentioned paragonymous calicoti, the lung fluke, do have zoonotic potential.
Many people can get them.
Meaning they could potentially infect humans, yes. It's generally much less common than in pets, but it underscores the broader significance of controlling these parasites.
Okay. And source one had that really strange specific association, I remember.
Yes, you mean the link they mentioned between Pneumonisodes caninum, that's the canine nasal mite, and an increased risk of gastric dilation and volvulus, or GDV, in dogs.
Yes. A nasal mite causing bloat. That seems completely unrelated. How could that happen?
It's a fascinating association the sources highlight, isn't it? The mechanism isn't fully understood, but it just shows how complex and sometimes really unexpected the impacts of these parasites can be on a pet's overall health, even if we don't quite grasp the why yet. So while the sources generally state that most infestations aren't fatal on their own, these potential complications we've listed can certainly be severe or even life-threatening.
Wow. Okay. So this deep dive has really shown just how much can be hiding beneath the surface when it comes to our pet's health, hasn't it?
It really has.
Sometimes it seems so minor, so everyday, maybe just a little cough, can actually be signs of these incredibly complex parasitic life cycles playing out inside our companions. It's definitely a hidden world.
Tricky for vets to diagnose, requiring very specific knowledge to treat and ideally prevent.
Yeah. Understanding these possibilities, though,
Yeah.
it doesn't mean you need to panic about every single sneeze, right?
Not at all. But it truly empowers you as a pet owner. Just knowing to discuss potential exposures, like if your dog eats slugs or your cat hunts mice or subtle signs you might notice, and understanding the importance of consistent prevention with your veterinarian, that's key to navigating this complex landscape. It helps you ask the right questions.
So, thinking about everything we've just uncovered,
Yeah.
these parasites with the really complex life cycles involving, snails, slugs, crabs, even sheep, awful.
Yeah.
Often causing symptoms so mild they're easily missed, or maybe no symptoms at all.
Right. Considering how many different parasites can hide out in the respiratory system, often with symptoms that look just like an everyday cough or sneeze.
No.
How many pets out there might be quietly struggling with infections we're not even looking for,
Yeah.
simply based on their lifestyle and where they happen to live?
Makes you wonder.
What silent invaders could be lurking, in our own backyards or on the trails where we walk our dogs right now?
Oh,